Immediately following an injury, the goal is to regain mobility in the joint.
The importance of a pre-surgery rehabilitation program is to gain full mobility in the knee joint before surgery, so that full mobility will be easier to achieve during the rehabilitation process after surgery. Heel slides should be done first using a towel in order to allow for passive movement of the knee joint. Sitting down, the client is pulling the towel towards himself, which passively causes flexion in the knee. This should be repeated 20 times, 3 to 5 times a week, with little or no pain. Once this exercise can be completed without any pain, the client can do the same exercise without the use of a towel, actively sliding his heel across the floor to bring his knee to 90 degrees of flexion. This should also be repeated 20 times, 3 to 5 days per week. For leg extension exercises, the client should first be able to passively extend their leg fully by gently pushing the kneecap down. This should be done for 8 repetitions, 1 to 3 times a day. Once leg extensions can be completed passively without pain, the client can begin to work on active extension of the leg, using a towel or some other soft surface as support under the kneecap. This should be done for 8 repetitions, 1 to 2 times per day. The client can then move on to active leg extensions without the use of support, which will additionally help to strengthen the quadricep muscles. This exercise should also be done for 8 repetitions, 1 to 2 times per day. Prone hangs are another effective way to work on leg extension. The client will lay flat on his stomach with his knees hanging off the table, and the force of gravity will push his legs to reach full extension. Rocking back and forth on an upright bike is an effective exercise to focus on regaining full mobility. It is important that there is no resistance on the bike during this exercise, as the focus is on mobility rather than strength. This motion should be done for 5 minutes, 3 to 5 times a day, as long as there is no pain experienced working, up to 15 minutes.
How long was that?
6 weeks following the injury, focus on having the patient work on mobility exercises standing up. This allows the patient to work on strength and balance as well as mobility. Have the patient stand on their uninjured leg while bringing the injured leg through extension, engaging the hip flexors. This should be repeated 10 times, 1 to 3 times a day.
A prone knee flexion is an exercise easily done at home and helps to restore range of motion for flexion.
While keeping your toes pointed to the ground, bring your heel towards your butt. Repeat this 10 times, 1 to 3 times a day, as long as no pain is experienced.
After 6 weeks and once mobility has been established, it is important to begin to work on strengthening the joint. A resisted knee extension with the band will help increase range of motion in the joint as well as strengthen the quadricep muscles. The opposing motion can be done for the hamstrings with a resisted band flexion. Once range of motion and strengthening have been established, the participant may want to move to an exercise such as a wall sit. Patients should work through a greater pain-free range at this point. As mentioned before, the bike is an excellent tool for the restoration of thigh strength as well as coordination. At this point, a full range should be done on the bike. It is crucial that the patient have full range of motion in flexion and extension as well as full strength prior to surgery.
The goal for the initial post-op program is to start increasing movement at the knee joint. It's important, though, to not push knee flexion past 90 degrees for the first 6 weeks. The client is going to continue to focus on the pre-op exercises done after the injury until full extension and 90 degrees of knee flexion is back. None of the weight-bearing exercises should be done at this time. We would also hope to see the client be able to walk without relying on crutches, and it's at this point that weight-bearing exercises can be reintroduced into the rehab program. 3 to 9 weeks after surgery is when the client should be able to begin their strength training exercises, while continuing to focus on mobility. Again, it is important that none of these exercises are done if there is serious swelling or pain in the injured knee. The splinter brace that the client is wearing should only be taken off for range of movement exercises, but should be worn the rest of the time. The first 3 exercises at 3 to 9 weeks post-op are the same leg extension, knee flexion, and wall slide exercises that were focused on in the 6 to 12 weeks after injury and will be demonstrated again. The client should then be able to progress to wall sits, in which they will go down as far as they can without going past 90 degrees of flexion. This exercise is important for building strength in the quadriceps. Half squats should then also be introduced into the program at this time. However, it is important that the client only does them within their available range of motion. Laying on his side, the client is asked to abduct his leg and hold for 5 seconds each time, repeating on both sides. This exercise is important for hip strengthening. Shallow lunges are important not only in strength training but also serve as an introduction to the upcoming balance exercises. They should only be done within the client's available range of motion. Calf raises are intended to strengthen the gastrocnemius and gluteus muscles, which provide extra support for the knee during balance tasks. The single leg stance is an important balance exercise for the client. It should be done on both the injured and uninjured sides of the body and will hold for 30 seconds each. This should be done at least 1 to 3 times a day. Once they have perfected this and advanced in the other balance exercises, they should try the single leg stance with their eyes closed, putting the focus on proprioception. Seated leg extensions can be done on a chair and then progress to a ball, where the client will have to focus on balance as well as leg strength. They will be asked to hold in position for 5 seconds and repeat on each leg. Using a wobble board is a good weight distribution balance exercise and should be done 1 to 2 times each day. At 9 to 24 weeks after surgery, the client should be able to bear his own weight during gait without a limp. The aim at this point in the program is to achieve full range of motion and strength. Some exercises that can be done during this time are calf raises, progressing from double to single leg, stair climbing, as well as stationary cycling with resistance. Once these activities can be completed easily and without any pain, the athlete is ready to start doing sport-specific drills. These can include jumping exercises, running drills, and eccentric exercises. The athlete cannot return to his sport until the surgeon gives full permission to do so, and the use of a brace is recommended at the start.